Thank you very much, Ali, and welcome everyone to this week's Lunch and Learn on the Indiana Tobacco Quitline. And we'll highlight the services of the program, and it can be a great clinical tool to keep in your clinical toolbox. So my name is Taylor Kenyon. I'm the Tobacco Prevention and Cessation Quality Advisor with the Indiana Rural Health Association. So as far as the agenda for today's call, we'll do a brief introduction on the Indiana tobacco prevention and cessation landscape, and then dive into and review the tobacco cessation interventions, really the 5 A's in the AAR method that you may be familiar with. And then thereafter, we'll dive into an overview of the Indiana Tobacco Quitline services, really comparing and contrasting between that primary service line that you may be familiar with and services by populations as well as to the more recent addition to the individual services, otherwise known as PIC-Quit. And then finally review some Indiana Tobacco Quitline frequently asked questions, and then open the floor for a brief Q&A. So with that all said and done, we'll go into the CDC's top 3 best interventions for cessation interventions to really start our conversation here today. And so coming from the literature, from the CDC and other sources like the Surgeon General's 2020 report on cessation, we have this model that's on the slide here that divides an effective and comprehensive tobacco intervention amongst these 3 buckets. So on the left here, we see promoting health systems change amongst health systems across a variety of levels to ensure that patients are asked about their tobacco use and status, and supported for their potential quit journey at each and every visit. And so providing the organizational change to ensure that that every patient is asked and advised to quit, as well as in this middle bucket, ensuring insurance coverage and utilization of proven cessation treatments, really coming from that payer and more of state level. And then finally, on our rightmost bucket on the slide, supporting that state quit line capacity. And that's really what we'll dive into today as well, with these variety of services that can be utilized to not only that can augment and have this comprehensive approach amongst these buckets. So with that being said, we have a variety of partners throughout the Indiana tobacco control landscape. So the Tobacco Prevention and Cessation Coalition, Commission maintains a community-based tobacco control partnership in about 43 Indiana counties among statewide partners that you see along the periphery of the map here, and it serves approximately 78% of Hoosiers. So alongside our organization, the Indiana Rural Health Association, there's a variety of other partners around the state that handle very specific areas of tobacco cessation across the state. So a variety of partners throughout that can help assist your needs throughout the state. So what is the role of a healthcare provider with tobacco prevention and cessation? And really this comes from the 2020 Surgeon General's report on cessation, in which we have these 2 figures here. We have 34% of smokers were not advised to quit by a physician versus 71% of smokers want to quit. So there's a rather large disconnect between these 2 numbers. And what we know from the evidence is that many tobacco users want to quit, and getting started often takes that support and motivation from a trusted source. So really to leverage that trusted physician-patient relationship, that clinical relationship, in order to have that patient quit just one time, it helps double their chances for success. So it's a great avenue in order to improve your patient's health. So how best may a clinician or provider intervene with tobacco and nicotine use? So there's a few different methods out there. One of which you may have heard of are the 5 A's, otherwise known as ask, advise, assess, assist, and arrange. And diving into those, starting with ask, is to identify and document tobacco use status for every patient at every visit. And in your clinic, you may want to wish to develop your own vital signs or stickers to help through your workflow processes to ask. As well, advise in a clear and strong personalized manner, urge every tobacco user to quit. Next, assess. Is the tobacco user willing to make a quit attempt at this time? Next, assist. For the patient willing to make a quit attempt, use counseling and pharmacotherapy to help him or her quit. And then finally, arrange. Schedule follow-up contact in person or by telephone, preferably within that first week after that predetermined quit date. Now, as you can see, these 5 A's is a rather comprehensive approach. And in doing so, it can be a lot to remember. And so some providers prefer the AAR method. It's a bit more concise. And we'll use this AAR method over the next few slides to guide how this may be utilized with the tobacco quit line.
Are others having trouble seeing the slides? We have one comment that the slides are not populating.
Brandy, are you able to see the slides? I think that first one I had purposely blank. I think I see one more that says that they can see the slides. Very good. I think it was just bad slide design on my end, but thank you for letting me know. So diving into this AAR method, and with the first with ask is to have every client in every visit and non-judgmentally ask that tobacco use status. So in order to provide that, provide treatment from the get-go, it's essential to begin that identification of what patients use tobacco and to document the patient's tobacco use. So asking about tobacco use should be considered as important as evaluating vital signs or even obtaining a medication history. And so screening for tobacco and nicotine use and providing tobacco cessation counseling are positively associated with patient satisfaction. Now, for some clinicians, there can be a bit of a discord of how to ask that tough question. And so one way you can do so is to ask permission in order to help reduce that discord between the patient and the clinician. And so there's a few samples I have on the left portion of the slide that can dive into these, or some scripts, if you will. So for example, do you mind if I ask you a few questions about your tobacco use? Or for another example, with an e-cigarette or vaping device, do you ever smoke or use other types of tobacco or nicotine, such as e-cigarettes, vape products like Juul? And it's essential to be explicit amongst these tobacco and nicotine products, because some patients don't equate vape products like Juul as a tobacco product. And so you can get very different answers depending on how you ask your question. And then finally, it's important for your treatment planning to also document the type of tobacco product being used, the frequency of use, the age of first use, and even the last time the client used any type of tobacco. It can be especially important and paired with a variety of other clinical tools as well. So next, in our AAR method, we have advise. So be clear, be strong, and be personal. So it's our responsibility as healthcare providers to assist patients in improving their health. And so patients identified as tobacco users should be strongly advised to quit. And at the very least, these patients should be advised to consider quitting, because it's very important to advise, but not to force a patient to quit. They have to begin their quit journey on their own accord. And so the message should be clear, it should be strong, yet personalized and sensitive and authentic, and ensuring to make sure that you do not have a judgmental tone when you advise to quit. And so advising these patients to quit should really be done in a way that shows concern for the patient's well-being and commitment to help them quit when they are ready. So important scripts that could be used for advising. The first one here being, quitting smoking is an important part of your overall recovery. Again, for a substance use patient. Quitting while you're in treatment for substance use disorder can help make reoccurrence of substance use less likely. If you'd like, I can share some information about the free help from the Indiana Tobacco Quitline, or when you're ready, I can help you with the quitting process. Our next example will be more from the e-cigarettes and vaping category. There's still a lot we don't know about e-cigarettes and vaping, but we do know that they have some of the same types of cancer-causing chemicals like formaldehyde that cigarettes contain, and people who use the proven methods to quit, like medications, can double their odds of successfully quitting. So the final of the AAR method, that refer portion, we have the Indiana Tobacco Quitline that can be a great tool in your clinical toolbox to ensure that you engage in this comprehensive tobacco cessation intervention. And so at a very high level, the Indiana Tobacco Quitline is a free telephone cessation counseling service that helps people quit tobacco. It's evidence-based, it's proactive, and the basis of this intervention is grounded in the U.S. Public Health Service clinical practice guidelines for treating tobacco use and dependence. And this includes both counseling and pharmacotherapy. And so this program works by allowing patients to quit at their own pace. They choose their own quit date. They have personal quit coach that helps guide them and prepare them to get ready for their quit attempt, as well as assisting patients with conquering those urges to smoke, helping them learn when and where those urges strike and how to cope and manage stress without smoking, as well as using pharmacotherapy so that they really work, and helping recommend the right meds for each participant and teach them how to use the medications correctly. So that way, the patient with their quit attempt can go through their last quit. So now we'll get through the variety of services that fall under the Indiana Tobacco Quitline program. It's a rather large umbrella that includes a variety of services that you see on the slide here, from the quit coach, the medications, the web coach, quit guides, as well as the text to quit. So I'll go through a brief overview of some of these services, and we'll dive a bit deeper in the slides that are coming up. As far as starting from the left, talking about our quit coaches, is that our quit coaches are highly trained in cognitive behavioral therapy with over 240 hours of training. They also have Spanish speaking competency, as well as 170 other languages, so don't let language be a barrier to refer. And they're educated up to the graduate level. And over 50% or half of the counselors, they have more than 3 years prior experience in counseling. But at a minimum, they have a bachelor's degree in counseling, addiction studies, community health education, or social work. And as I mentioned, many have graduate level degrees, as well as their previous experience really centering on that behavioral change programs and interventions that are related to them. And so all these quit coaches have strong communication skills and the ability to demonstrate empathy, which is vital to assist someone in their quit journey, as well as abstinence from tobacco and nicotine for 2 or more years. And so these multilingual quit coaches are trained to discuss all 7 of the FDA-approved medication options and make recommendations and encourage meaningful follow-up with healthcare providers. And just to remember, those 7 FDA-approved medications include that nicotine patch, nicotine gum, nicotine lozenge, nicotine nasal spray, nicotine inhaler, bupropion, and Vericlean. And so the other services under the Indiana Tobacco Quitline umbrella include a starter pack of nicotine replacement therapy in the form of nicotine gum, patches, or lozenges, and we'll dive into program eligibility in the next few slides, as well as a web coach that provides a fully integrated dashboard that provides videos as well as other educational materials that can help guide the patient through their quit journey, as well as print materials that are stage-based and provide a variety of reflection and other opportunities to best support and prepare the patient for their quit journey. I particularly enjoy the Ally Guide that is great for a significant other who lives in the home, as well as the text to quit options that provides messages and tips for the patient during their quit attempt, including reminders about to take their medication, as well as the amount of money that they're saving during their quit attempt by not using tobacco products. So let's dive a little deeper into some of these services. So when a person is ready to quit, a quit coach will assist in making a quit plan. Each patient is different, but all these quit plans will include counseling sessions and a quit kit. And a person is encouraged by the quit coach to contact a physician for cessation medications and will be given information about community quit programs as well. And so even if they are not ready to quit, the Quitline staff will help them figure out what is needed to prepare them to successfully quit. So I think it's always a great option to have in order to help support the patient towards that ultimate quit attempt for their quit journey. As far as the web coach services, if the patient chooses to enroll, they will click on the registration and the assessment pages, and they will fill out basic information. The web coach site's straightforward and easy to follow and navigate, and the content arrangement will keep the information consistent and simple. And I'll provide at the end the variety of ways to refer to the Quitline for both the web and the telephonic services. So have no fear. But from the high level here is that the patient will select a quit date. They'll choose a medication, manage their urges in order to help manage their urges to use tobacco, and help provide a bit of reflection in order to help control their environment from social and behavioral stressors that could be that's very vital in order to prevent relapse, as well as a variety of other resources to help get and maintain support. And as well, I do like to highlight here is that the quit plan can then be printed or emailed for offline reference. So if they can tape it to the closet door or in their office, and so in order to help keep them reminded of their commitment to their quit attempt. Now, the text to quit option. The text to quit is a service that sends personalized text messages to help quitters manage their quitting attempt. And so text to quit helps participants stay connected with their quit coach or with the web coach as well, and manage those cravings to smoke and get the right medication at the right times in order to prevent relapse. And so this is all available at the convenience of their cell phone. And these text to quit options are part of a clinically proven successful way to manage the quit process. Again, as we started off in the beginning of this presentation, one portion of the comprehensive approach to supporting patients with their quit attempt. And so, again, the evidence is strong with this one as well. But a few of the examples up here of what specifically the text to quit option comes with, including sends up to 300 messages that are tailored to the individual's quit plan, as well as quit call reminders with the quit coach, and as well as other medication reminders and helpful suggestions and tips and games in order to help prevent relapse and those craving urges, as well as mobile tracking of tobacco usage, urges, cost savings, and other measures that can help contextualize the patient's quit attempt. So oftentimes we hear from a variety of providers, I refer the patient to the Quitline, but what's the participant or the patient experience? And so over the next few slides, want to break down what the patient experience is so it doesn't feel like a black box or a blank slide. So really it's divided into these three buckets, from registration to that initial intervention, and then the follow-up sessions. And so starting from the left and moving to the right, during registration, the registration intake specialist collects all demographic and medical required data. All services available are described to the caller, and plans are made to arrange for shipment of written materials, and a transfer is made to the next available quit coach. And during this initial intervention, the Quitline staff assesses some baseline information from the resident. And this call is really key to develop a quit plan and help the participant set a quit date. and support and direct on that medication use as we've discussed previously. Then follow-up sessions will provide proactive support to the participant to touch on key factors to support the patient's quit attempt. Calls are timed to connect with the quit date as well as several high likelihood relapse times. So for example, the quit date, 1 week post-quit date, etc. And these call times are custom to the participant's progress, and participants are always welcome to call in for support anytime and as many times as they need. And then finally, there's an end of program call that determines the quit status of the patient and ultimately the satisfaction with the program. So let's dive into the variety of services as well as a variety of services by different patient populations. So I know this is a bit of a busy slide, but I want to direct your attention to the leftmost portion. We have a variety of programs by population. So we have adults, youth, pregnant women, behavioral health consumers, and then we have our individual Quitline services that are now being branded as Pick Quit. And I want you to keep this one in the back of your mind. We'll talk about this a bit more later in the presentation as well, but I just want to make sure it's included in this nice, easy to see format on this table. So starting from the top left, the adult program will have 4 pre-arranged calls with a quit coach, as well as unlimited call-ins to the Indiana Tobacco Quitline. So what this means is that the patient has 4 prearranged calls in which the quit coach will call them, but the patient can have unlimited amount of call-ins to the Tobacco Quitline for more support. So I'll make sure that that point is clear. As well as other portions in this program include the text messages to connect with the quit coach, as well as access to the online tools and educational materials through quitnowindiana.com. And they're also as eligible the 2 weeks of free nicotine replacement therapy, whether it be patch, gum, or lozenge if available. And then moving on to the youth program, this program differs slightly with 5 prearranged calls, as well as the unlimited call-ins, text messages to quit, as well as access to the online tools, videos, and educational materials as well. However, the nicotine replacement therapy is not eligible to the youth program. The pregnant woman program is a bit more intensive with 10 prearranged calls due to the specific needs of this patient population with postpartum and a variety of other other conditions that can affect the quit journey of the patient. So again, similar approach as the previous portions: unlimited call-ins, text messages to quit, and access to those online tools. But moving on to our behavioral health program, this program differs slightly in which it is a bit more intensive to the specific needs of behavioral health patients. And I'll dive a bit more into how this program differs in the next upcoming slides, but these quit coaches have received additional training on mental illness and tobacco cessation. But this patient population receives similar amounts of services to the previous, including this unlimited call-ins to the Indiana Tobacco Quitline, i.e. the patient calling the Tobacco Quitline, those text messages, as well as access to online tools and videos and educational materials at quitnowindiana.com. But what differs is that this program has access to a free 12-week regimen of combinational therapy of nicotine replacement therapy, so patch and gum or lozenge, as well as a letter sent to the provider informing them of their quit attempt. So we'll dive a bit more into how these programs work now. And at the end, we'll talk a bit more about the Indiana Tobacco Quitline individual quitline services as well. So the adult cessation program is focused on this semicircle you have here, in which we have our calls around the circumference here. And then we have the summary of the services available inside the circle. So the adult tobacco program, the patient will have access to the quit guide, those unlimited inbound phone support, text to quit, nicotine replacement therapy and medication support, the Quit Now mobile app, the web coach. So there's multiple modalities in which the patient can get access to services. And so these calls, as I mentioned previously, are centered around key parts or key relapse points for the patient during their quit attempt. So we have the initial call one with that assessment and planning call, following, of course, that enrollment via phone or the web-based portal, as well as that call two being the quit date call in order to help ensure the patient is supported for their quit date, as well as successive calls following the quit date in order to help ensure the patient feels supported to prevent relapse. So call 3 and 4. And then finally, an evaluation survey call that will come following the program. And so this 4-call tobacco cessation program is really geared to progress over the next 30 to 60 days. Moving on towards the youth program, again, a bit more intensive with 5 calls as opposed to 4, including the resources, the email support, web coach, unlimited inbound phone support, the referrals to educational websites and materials. And so the calls following enrollment include that assessment and planning call, a pre-quit date call in order to help reinforce and prepare for the quit date, the quit date call, and then ongoing support calls to help prevent relapse. And so this youth program is geared towards youth 13 to 17-year-olds, Indiana teens, and they receive this more comprehensive or more intensive, I should say, with 5-call program. And these counselors are trained in youth tobacco cessation and counseling. And specifically what this includes is that they receive more age-appropriate educational materials discussing peer influencers and other triggers that are a bit more relevant to this specific patient population. Next, we have our pregnancy tobacco cessation program, and this is an intensive 10-call program for pregnant tobacco users. And in sum, this intensive behavioral support is really tailored to the unique needs of pregnancy and includes postpartum contact to help prevent relapse as well. And so access to web coach, text to quit, the quit guide, and unlimited inbound phone support. And so following that enrollment, we have that assessment and planning call, that pre-quit date call to prepare for the quit date, the quit date call, and then ongoing relapse prevention with calls 4 through 7. And then that call 8 will be the pre-due date call. And then 9 and 10 will be that postpartum calls in order to help prevent that relapse. And then finally, an evaluation survey. And now I do want to take a moment and talk about the eligibility of the behavioral health program before we go through the behavioral health program summary as well. And so from the provider perspective, please feel free to talk with your patients about this program in which that those callers who report schizophrenia or bipolar conditions, like in this first question during the assessment call, they're automatically offered enrollment for the behavioral health program. Those who report depression, anxiety, PTSD, or substance use disorder are asked a question to assess whether they believe their condition will interfere with their ability to quit and to stay quit. And those who respond affirmatively, yes, are offered enrollment. So they'll get the second question. Do you think these mental health conditions or emotional challenges might interfere with your ability to quit? And so as you as a provider, if you believe that your patient may benefit from this, you can let them know that they'll ask these questions and help and prepare them for these questions. It's important to note that there is no proof of medical diagnosis information required to be submitted by the caller or provider in order to be eligible for this program. It is purely a self-report. So please keep that vital aspect in mind. And so again, if the patient qualifies for this program through reporting yes to these questions, they will be enrolled in a behavioral health tobacco cessation program. And as I mentioned in the previous summary slide, this is an intensive program that's geared for the unique needs for those who have mental health conditions and other emotional challenges. And so the Indiana Tobacco Quitline began offering this program in order to meet those needs. And the design includes a higher intensity of behavioral and pharmacological support. And it consists of 7 scheduled calls to provide that additional support through not only the pre-quit planning phase, but also to help prevent relapse. The 12-week regimen of combinational therapy of nicotine replacement therapy, the patch, and gum or lozenge, as well as a letter sent to the participant's healthcare provider informing them that their patient is attempting to quit tobacco and giving them some suggestions on how they can support them in the process in order to provide that fully comprehensive approach for this quit attempt. Now, the team of dedicated quit coaches has received additional extensive training on mental illness and tobacco cessation, and they are able to flex intervention content and tailor the treatment to these participants. And so it's important to note that enrollees in this program, they must continue to receive phone counseling in order to receive the 3 installments of combinational nicotine replacement therapy. So please make sure that you advise your patients to continue their phone counseling if they wish to continue their installments of nicotine replacement therapy. And so in sum, this smaller, more dedicated team of coaches working with these participants, they receive a variety of trainings in order to address these challenges of those patients with behavioral health conditions. And so it's a bit more, these are a bit more seasoned coaches that are available to these behavioral health patients. And so in the standard format of our other program summaries, we have our 7 calls from the assessment to planning, the pre-quit date call, our quit date call, as well as post-quit date follow-up calls and ongoing support calls in order to help prevent any potential relapse. And finally, an evaluation survey as well. And so in some, they have access to the mobile app, the quit guide, provider letter, that 12-week of combinational nicotine replacement therapy, text to quit, web coach, and that unlimited inbound phone support. And I think it's important to highlight the successes with this, especially with this behavioral health program, considering the unique challenges that behavioral health patients have with cessation. And so research has shown that only 4 to 7% of tobacco users who try to quit smoking on their own are successful. And with the follow-up evaluation surveys, we've had about 43% report that they've had quit 7 months after receiving phone treatment, and 87% would recommend the phone program to other tobacco users. So again, a very effective program. So now I want to segue away from the more traditional umbrella of the services under the Indiana Tobacco Quitline and talk about the individual services, or otherwise known as pick quit. And I like to mention these as more of an a la carte service in which the patient is able to pick and choose a variety of services under these 4 standalone services in order to personalize the support that they need for their quit attempt. So it really offers a great means for a provider to provide personalized assistance with a patient's quit attempt. And I also like to make mention as well is that it can really be utilized in order to get around barriers that the patient may have regarding some of the services or offerings from the traditional services. So for example, if a patient is nervous about talking to a quit coach on the phone, someone they haven't met before, they can still get support through these 4 standalone services that maybe they want to go with the texting option and get those print materials, as well as a starter kit of nicotine replacement therapy in order to work their way up and try out and get their foot in the door with that one follow-up call. Or maybe just engage with email messaging, since it's a bit more, it may be a better modality for that patient. And so this enrollment for this individual services can occur via online or for phone. So there's no difference in referral from the provider perspective. So the same aspects of referral um, from either the phone or the online portal. And so it allows that flexibility, and the intention is to reduce those barriers, increase quit attempts with patients, and to increase reach. So what this looks like from a bit more of a visual perspective here is that we have what I would consider the more traditional approach to the Indiana Tobacco Quitline, that's divvied up from those unique patient populations and the services including texting, web portal, nicotine replacement therapy, and the unlimited inbound calls. On the right here, we have the individual services that's a bit more a la carte, in which the patient can mix and match specifically the services that meet their needs. And specifically, the patients have the flexibility to add on services at any time, so they can get started and they can get more support or less support as they need. Another newer feature as well is to text to start. And so the state, Indiana, is making it easier to quit tobacco and help patients enroll in these free services by simply texting "ready" to 200-400, pardon me, 200-400 in order to register for these free services from 1-800-QUIT-NOW. So again, easy as 1, 2, 3, text "ready" to 200-400. They answer 3 questions: name, zip code, and permission to call and leave a message. And then a professional quit coach will call the patient within 48 hours to enroll in services. And they can call and connect through the variety of these modalities, from 1-800-QUIT-NOW to this text to start option as well. So again, the patient can cancel this free service at any time. So no obligation, and help reduce the barriers to engage the patients in a quit journey that's right for them. Now, as we mentioned as well, in order to help provide more of this perspective to you all, the healthcare providers, that there are outcomes reports available for healthcare providers that detail the participant outcome based on the referral that was made. And so these outcome reports are only sent to sites that are HIPAA covered, and specifically all the clinic information and referral site information will appear. And this is a sample that's provided as well. So diving a bit deeper, in case the text is a bit small for you, is that the report details the contact date, the service status, so whether the patient's unreachable, declined, or accepted, program enrollment, 1 call, multiple call, nicotine replacement distribution, and expected quit date. And so from the provider perspective, it's really essential to make sure to remind the patient that they may receive a 1-800 call or an unknown caller as the quit coach makes their initial call, assessment call. And so the Indiana Tobacco Quitline will make 5 attempts to reach the caller, and at least 1 voicemail message will be left. And so in order to help guide your outreach and to really tailor it to your clinic's needs, there's a variety of free promotional materials available. And there's a variety of postcards, palm cards, and those that are the size of business cards as well, that can really be utilized in your clinic. And so we have those that are more geared towards pregnant populations, to diabetic populations, to youth and mothers, as well as vaping devices. So you can really tailor it to how you wish to engage with your patients in order to make it an authentic conversation. As well, co-branding is an option with the materials, so do make mention of that if you wish to co-brand the materials with your clinic or facility. And so it's a great aspect in order to engage these patients. And so moving on, I do want to address some of the common questions that we hear about the Indiana Tobacco Quitline, really diving into these frequently asked questions, and then we can maybe open the floor to a bit of a Q&A if there are any available. But Does the program help with all forms of tobacco use? And so, yes, it does so. And it can be a great avenue in order to refer your patient in order to get that support. And especially, I like to make mention, it's a great way in order to refer your patient through that AR method, even if your time in the clinic is running low, in order to make sure that you are addressing all the health needs of your patient. Next, will the patient's insurance determine if the Indiana Tobacco Quitline can proceed with services? Um, and so the insurance information is collected. Yes, it's an important part of the uh, assessment portion of the first call. However, having commercial insurance does not determine whether the patient will receive Indiana Tobacco Quitline services. So if that is a fear of the patient, please have that conversation with them. As well, is there a limit on the amount of nicotine replacement therapy that the participants receive from the Tobacco Quitline? And so the Tobacco Quitline participants may be eligible while supplies last for either the 2 weeks free nicotine replacement therapy, or for that behavioral health population, 12 weeks of nicotine replacement therapy for the behavioral health program participants once a year. And then as well, what is the timeline to receive that first call from the Indiana Tobacco Quitline once that referral is made? And so the participant will typically receive a call within the first 48 hours of referral, and the participant should be informed that the call will come from that unknown number or that 1-800 number. And so encourage the patient to answer the phone within those first 48 hours. I think we're all aware there's constant robocalls out there, but guiding them that it may come within those 40 hours may help reduce the anxiety to answer one of those calls. And so, in that same vein, what shows up in the caller ID when the Tobacco Quitline calls? And so, this really varies depending on the cell carrier. The Tobacco Quitline does not have complete control over what shows up on the caller ID, so that's why it's really really important in order to guide the patient to answer those calls. And just to reiterate, is that the Tobacco Quitline will leave a voicemail for patients out of their 5 call attempts, provided that there is a working phone number that is sent with the referral. And so there's a great amount of information that's provided on quitnowindiana.com that can be utilized in order to provide some follow-up guidance on how to best refer to the Indiana Tobacco Quitline. But you can do a variety of through the fax modality, which you can get free fax forms from quitnowindiana.com, as well as the 3Quick online referral portal as well. And so it's easy as 1, 2, 3, and you can get your clinic registered for that service as well through the quitnowindiana.com. And so there's a variety of options, and you can really tailor it to the workflow and needs of your clinic, and you can get that feedback through those sample outcomes reports that we mentioned before. So again, all taken together is that the Tobacco Quitline is one step of a comprehensive intervention of tobacco use with a patient. And so remembering and practicing the 5 A's or the AR method, and being familiar with a variety of these services can help ensure that that your patient's quit attempt is that final quit attempt, so that they're quit for life. So again, I will pause there and open the floor as we're reaching the time here today for this lunch and learn, if there are any questions. But if not, there are a variety of resources available to ask questions, not only from quitnowindiana.com, but as well as my contact information that's at the beginning of this presentation, as well through Natalie Rivich, who is the Quitline manager with the Tobacco Prevention and Cessation Commission. So I will pause if there are any questions. We can address those, and otherwise we'll have a great rest of your lunch.
We don't have any questions that have come in yet, but we will go ahead and pause if anybody wants to type any in, or again, use that raise hand function. If you'd like to ask your question verbally, we can certainly do that as well. But really appreciate the thoroughness of your presentation today, Taylor. Again, we will have this posted to our YouTube channel by the end of the week. If there's anyone you want to share or post this, it is free for everybody to go right ahead, grab that link and share.
Thank you very much, Allie. And while we just wait one more moment in case anyone is typing, I just want to highlight if there are, while we only had time for a bit of a brief presentation today on the tobacco cessation intervention, as well as the tobacco quitline services, if there are any needs as well as examples of how to integrate this in your workflow, please feel free to reach out to either myself or Natalie Rivich, and we can always provide a variety of toolkits and other examples that can help really make this type of intervention concrete for your clinic. But otherwise, I sincerely appreciate the time today, and have a great rest of your lunch for this Lunch and Learn.
Thank you, Taylor, and thank you to all of our attendees.